Anyone hurt on the job in Texas will be covered by workers' comp, right? Not always.
In fact, doctors are bailing out the system, and injured workers say the system is bailing out on them. Channel 8's Brett Shipp has been investigating workers' comp for 7 months. He's live in studio tonight with more. Brett?
John, in the past, complaints about workers' comp systems focused on people faking injuries and doctors abusing the system. In an effort to correct fraud and cut costs, some say the pendulum has swung too far the other direction. The complaint now that patients with legitimate claims go untreated, their doctors go unpaid, and that insurance carriers control the system while state officials look the other way. Tonight, News 8 investigates.
He said, I have never been through anything like this in my life.
Rose Douthit of Waxahachie stands at her husband's grave, unable to shake her grief and anger. 58-year-old Pierce Douthit died in December after suffering for years with a work-related back injury, an injury that she says was never fully treated through the Texas workers' compensation system. Workers' comp insurance paid for 2 back operations, but a third his doctor recommended was repeatedly denied. Rather than endure more pain and constant appeals, Douthit took his own life.
I think if they drag them out, people will give up. Well, after 6 years, Pierce gave up.
I've seen it take a toll on numerous patients.
Douthit's doctor, Charles Osborne, says 2 of his patients have committed suicide since the beginning of last year. Both repeatedly denied medical treatment through the workers' compensation system.
The system is definitely not working. It's failing the people of Texas that get injured because of the delay tactics that are used, and the commission allows it.
The workers' comp mission statement is this: to ensure appropriate and efficient health care for all injured employees and fair and reasonable reimbursement for their doctors. But a majority of patients we talk to in workers' comp field offices feel the insurance carriers are the ones being protected.
They deny, and that's their strategy.
No matter what, they seem to deny. No matter what proof you have, they want to make you prove it.
Workers' comp statistics from 2001 show that of 203,000 claims filed by workers, 77,000 workers filed a dispute. That's 38% who feel their benefits have been unfairly denied by the insurance carriers. The end result? Patients and doctors are forced into what many say is a confusing and lengthy appeals process.
And so the injured worker or their health care provider has to come in, and they basically have the burden of proof to prove that the treatment that's been denied is reasonable and necessary.
Let's stop right there. You just said the provider and the patient, the claimant, has the burden of proof. Is that how this system is supposed to work?
Yes.
Fighting me every single step of the way.
Former steel worker David Carter of Ennis injured his shoulder, back, and leg in a fall at work last May. Carter's doctor determined it would not be prudent to postpone surgical intervention on his back. But the insurance carrier is denying him surgery based on the opinion of its own hand-picked doctor who determined surgery was not needed. Carter says the doctor's exam lasted 3 minutes. How much faith do you have in this workers' comp system after being told this by this doctor?
Not much at all. No.
Another problem Carter faces, finding a doctor to treat him. The number of Texas physicians registered to provide treatment within the workers' comp system has dropped from 30,000 to about 13,000 in the past year.
Many of the fine doctors in Fort Worth and Dallas have dropped off of the system.
Dr. William Van Wyk says he is among those dropping out. He says he's tired of being second-guessed by insurance company doctors. What's more, the Workers' Comp Commission has just cut doctors' fees by an average of 15%, but by as much as 50%. Workers' comp officials say payouts to Texas doctors have been among the highest in the country and needed to be contained. Dallas orthopedic surgeon John Gill, who has also quit taking workers' comp patients, says the injured workers are paying the price.
Because I think that they're going to have a hard time getting access to good, high-quality doctors to take care of their injuries when they are, legitimately injured on work and they need care.
Critics say the inequities can be traced to Workers' Comp Commission Executive Director Richard Reynolds and his 5-member board, all of whom are appointed by the governor. They say Reynolds especially is too closely associated with the insurance industry.
He declines to be interviewed.
After repeated unanswered calls to Reynolds, we caught up with him after a Workers' Comp Commission meeting in Austin.
We're doing a story on some of the perceived inequities and criticisms of the workers' comp system.
I have no control over what's perceived. That's all my comment.
Okay. Do you have any relations with the insurance industry? Have you ever lobbied for, or ever worked for the insurance industry?
No. The
Never?
answer to that is no.
I have never.
You have never what?
Worked as an employee of an insurance company ever. I've never lobbied for an insurance company. Period.
But according to State Ethics Commission records, Reynolds was a registered insurance lobbyist in 1999 and 2000. Even his old business card spells it out. Reynolds and Associates, insurance specialists. Commission Chairman Richard Smith says the critics are wrong about Reynolds.
My judgment is that the system works well. Is it perfect? No.
Rose Douthit says her husband never asked for perfection, only the medical attention he thought he was due.
I know I just lost the best thing that's ever happened to me.
A special panel of state lawmakers has been appointed to study the performance of the state workers' comp system. And in the coming days, we'll continue our own investigation into a system that virtually everyone agrees is broken.